Great, thanks for having me, and I know it's been a long day, so thank you for staying. All right. So a little bit of background about our project. In acute COVID, like we've all talked about, platelet and endothelial dysfunction is elevated and actually predicts mortality in critically ill patients. Within 60 days after COVID, coagulopathy and endothelial dysfunction is still present and can correlate with the 6-minute walk test and function. There is evidence of microclotting, as we heard earlier, with unclear clinical implications at this point, and is unknown if vascular inflammation persists in individuals with neurologic PASC. So the most common symptoms that we see neurologically are cognitive impairment, mood changes, headache, and neuropathy, among others listed there. We investigated for vascular inflammation in individuals with neuropsychiatric PASC compared to individuals with post-COVID but no PASC. All right. So we recruited both from our neuro-COVID clinic and from the community, self-referrals. Again, our participants were COVID and PASC positive, and our controls were COVID positive and PASC negative. So here I'll be talking about the blood draw, and next talk I'll talk about the MRI. So we used a ELISA on plasma-based assays, and we tested 8 cardiovascular markers on the right. Our demographics, we had 2 very similar groups. We had 40 individuals with neuropsychiatric PASC. The age was similar to our controls, as well as gender, race, days since COVID illness, as well as numerous vascular risk factors that could also be affecting these markers. In terms of long COVID symptoms, as we know, each participant has numerous symptoms, and so these were the most prevalent. Fatigue, poor concentration, poor memory, difficulty with word finding, anxiety, depression, new or worsening was present in the majority of participants, as well as headaches and peripheral numbness, which a lot of the times, as we've talked about, may be related to small fiber neuropathy. But we included other individuals with other neurologic symptoms as well, including anosmia as well as dizziness. So the results, these are the 2 factors that were normal, that didn't show any significant difference between the 2 groups, platelet factor 4 and AGP. And then in terms of what we did find was that several markers, so 6 markers, were significantly different in the long COVID group compared to our controls. Alpha-2 macroglobulin, C-reactive protein, Fetuin A36, which the increased risk is a lower level, so that was in the appropriate direction, as well as haptoglobin, a systemic inflammatory marker, L-selectin, which I'll talk about, and serum amyloid protein. So to summarize, we demonstrated key differences in vascular inflammatory plasma biomarkers in individuals with neurologic PASC, including differences in plasma proteins that indicate ongoing systemic inflammation reflected by elevated CRP, haptoglobin, and SAP. Endothelial dysfunction is present with the presence of elevated alpha-2 macroglobulin. And then markers found to be present in atherosclerosis include L-selectin, Fetuin A36, and SAP. So this was very interesting to us. And in terms of theory for long COVID, makes sense because the vessels are in every organ system in the body, and every organ system seems to be affected by long COVID. So we're very interested in this question of whether individuals with neurologic PASC may be at risk of persistent vascular inflammation, endothelial activation and inflammation and dysfunction, and or atherosclerosis. I think that would be, given the wide prevalence of the Omicron strain important not only for individuals with long COVID, but also anyone who has had long or COVID period, if atherosclerosis is accelerated or worsened by COVID illness. So further studies that we'll be investigating will look at endothelial inflammation and atherosclerosis in individuals with neurologic PASC. So I'd like to acknowledge it takes a village. Serena Spudic, who's here, and my mentor, Shelley Farhadian, our wonderful funding support, and our great COVID Mind study team. Thank you.